Hello and welcome. Today we will see about nutrition in pregnancy. The foundations for maternal and fetal health. So, why does maternal nutrition matter? Nutrition shapes immediate and lifelong health trajectories, affects neurodevelopment, birth outcomes, and chronic disease risk. Global significance: over 600 million women affected by anemia or malnutrition. So, prioritizing science-based universal nutritional interventions is needed. Here are the outlines: physiological changes, macronutrient needs, micronutrient essentials, dietary guidelines, supplementation evidence, food safety protocols, common nutritional issues, and lastly, we have call to action. Adaptations during pregnancy: 50% increase in plasma volume and red blood cell mass, elevated iron needs, the extra 300 kilocalorie per day needed in second and third trimesters, increased placental and fetal nutrient demands, altered metabolism, insulin resistance, lipid shifts, increase in basal metabolic rate. Caloric intake guidelines: energy needs around 340 kilocalorie in the second trimester, 450 kilocalorie in the third trimester. Healthy weight gain: normal BMI 11 up to 16 kg, underweight 12.5 up to 8 kg, overweight 7 up to 11.5 kg, and obese 5 up to 9 kg. So avoid eating for two, focus on nutrient density. Protein requirements: increase recommended dietary allowance, about 1.1 gram per kg per day, approximately 71 gram per day in most women. Supports fetal placental growth, maternal tissue expansion, and immune function. Sources: lean meats, dairy, legumes, nuts, and eggs. Carbohydrates and fiber intake: carbs 45 up to 65% of total energy, prioritize complex carbs. Fiber 25 up to 35 gram per day to reduce constipation and improve glycemic control. Choose whole grains, legumes, fruits, vegetables. Avoid added sugars and refined carbs. Fats and essential fatty acids: 20 up to 35% total energy from fats. Emphasis: unsaturated fats, olive oil, nuts, and avocado. Omega-3s: DHA or EPA 200 up to 300 mg per day, benefits neurodevelopment. Limit high mercury fish, example shark or swordfish. Folate and iron: folate 600 microgram per day, prevents neural tube defects. Iron 27 mg per day, WHO recommends 30 up to 60 mg to prevent anemia. Enhance absorption with vitamin C, avoid pairing with calcium or tea. Calcium, vitamin D, and iodine. Calcium 1000 up to 1300 mg per day, supports fetal bones and circulation. Vitamin D 600 up to 1000 international unit per day, reduces preeclampsia, preterm birth, and asthma risk. Iodine 220 microgram per day, critical for thyroid and brain development. Choline, vitamin B12, zinc, and others. Choline 450 up to 550 mg per day, important for brain or spinal cord development. Vitamin B12 2.6 microgram per day. This is essential especially in vegan diets. Zinc 11 up to 14 mg per day. It supports immunity and growth. And also watch vitamins A, C, E, and magnesium levels. Prenatal vitamins. Standard formula: folic acid 400 up to 600 microgram, iron 30 mg, calcium 200 up to 300 mg, vitamin D 400 international unit. WHO recommends daily iron plus folic acid universally. Multiple micronutrient supplementation is beneficial in low-income populations. Vitamin D strategy: routine supplementation 2000 up to 4000 international units per day to reach greater than or equal to 30 nanogram per milliliter serum. It reduces risks of preeclampsia, preterm birth, and infant asthma. Global dietary patterns: diversified diet, fruits, vegetables, lean protein, whole grains, dairy. Follow WHO antenatal feeding guidance. Use MyPlate or similar models for balanced nutrition. Preventing foodborne illness: avoid raw or undercooked meat, seafood, eggs, unpasteurized dairy, daily meats. Limit caffeine to less than 200 mg per day. Avoid alcohol completely to prevent fetal alcohol syndrome. Morning sickness, constipation, and heartburn. For nausea, small, frequent, bland meals, and avoid triggers. For constipation, increase fiber, fluids, and physical activity. For heartburn, avoid fatty, spicy foods. Elevate head of bed. Anemia, gestational diabetes mellitus, obesity. Treat anemia with iron plus folate. Manage gestational diabetes mellitus with complex carbs, balanced meals. And for obesity, focus on nutrient-dense, moderate calorie diet, physical activity and hydration. Greater than or equal to 150 minutes per week, moderate exercise improves mood and labor outcomes. Hydration greater than or equal to 2 up to 2.3 liter per day fluid, more in heat or with exercise. Avoid smoking, alcohol and illicit drugs. Emerging scientific questions: optimal vitamin D dosing for different populations. Long-term outcome of multiple micronutrient supplementation. Role of choline and DHA supplementation. Potential of personalized nutrition via genomics and microbiome. Key takeaways: balanced macro plus micronutrient-rich diet essential. Supplement when needed. Food safety and lifestyle matter. Global guidelines must be evidence-based and equitable. Call to action: adopt universal prenatal supplementation policies. Implement robust antenatal counseling worldwide. Invest in research. Vitamin D, choline, multiple micronutrient supplementation, genomics. Collaborate across science, policy, and healthcare sectors. And here we go. Here is the nutrition. And here we go. There you go. There you go. That is the nutrition. There you go. That is the nutrition needed in pregnancy. Thank you for watching and don't forget to subscribe for more health infos.